Hello friends, my name is Dr. Cervical Kasar. I am consulting obstetrician and gynecologist working as consultant at 7 Orange Hospital, Chinchwad. So today we are going to talk about a very important topic, that is the cervical cancer. So whenever we are listening about the word cancer, we are always afraid. We are thinking that cancer is cancer. If we are having cancer means our life is cancer. But this is not applied to this cancer. Cervical cancer, although very common cancer worldwide, it is the fourth most common cancer worldwide. In India, it is the first common cancer. Every year, 5 lakh women are having this cancer. Out of these ladies, 2.5 lakh ladies are dying every year worldwide. So, which type of symptoms we are having if we are having cervical cancer? Mostly cervical cancer patients are having abnormality with their menstrual cycle. It can be irregular bleeding, it can be heavy bleeding, it can be post-menstrual bleeding, it can be post-menopausal bleeding, or the bleeding after sexual activity. Some patients are having foul-smelling white discharge from vagina if they are having advanced stage of cervical cancer. Sometimes there are also the symptoms of weight loss, fatigue, loss of appetite. So, after knowing all the symptoms, how we can diagnose? So, it is very easy to diagnose cervical cancer. That is only one test that can diagnose cervical cancer in 80 to 90% of cases. That is called pap smear test. So what we are doing in this test? Pap smear test, whenever you are fixing your appointment with your gynec, they are collecting the cervical smear, that is the discharge present on the cervix, and then under microscope we are checking abnormal cells that are shedding from the cervix. So if the lady who is having pap smear test positive, then the next step is to go for colposcopy. Colposcopy, it is the high resolution camera that is diagnosing abnormal cervix. So by these two tests, we can diagnose cervical cancer in very early stage. After diagnosing, of course, the treatment depends upon the age of the patient, marital status of the patient, and the staging of the cancer. If the cervical cancer is limited up to the cervix, we have to remove the uterus. But the cancer has spreaded to uterus or the surrounding organ, then the treatment is either chemotherapy or radiotherapy. Now we all are knowing the dictum, prevention is better than cure. So here, in case of cervical cancer also, this dictum applies very well. Why? Because cervical cancer is, although very common cancer, but it is also the most preventable cancer. Why? Because cervical cancer can be diagnosed in very early stages, and if it is treated in early stages, then 90% of survival rates are there. So, for prevention of cancer in your kids, in your female or in your male child, we are having one vaccine, that is called HPV vaccine. Here, for cervical cancer, human papilloma virus, it is the culprit in 99% of cases. So for that, there is one vaccine developed since 2006. It is available globally. This vaccine, there are 2 doses from the age of 9 to 14 years. After 15 to 26 years, there are 3 doses. So, if you are having male child, if you are having female child, you should give this vaccine starting from the age of 9 years. In case of female child, irrespective of her menstrual status, you should give the vaccine. So, if you are giving this vaccine, you are securing the future of your kid. So, this vaccine is preventing not only cervical cancer, but it is also preventing anal cancer, penile cancer, vulval cancer, and vaginal cancer. So, in India, since 2024, we are having our own developed countries vaccine that is called Cervavac. It is very much cost effective vaccine that is developed by our Serum Institute, available at only 2000 rupees. This vaccine you should give to your kids and you should secure their future. That will prevent them from developing this cancer in their future. So, friends, let's unite and eliminate this cervical cancer globally. Thank you.